At Cyteris, we understand that choosing the right indication is one of the highest stakes decisions for the firm. So we really make sure that we understand the characteristics and the clear differentiation of the drug. Depending on the biology of the drug, the list of indications can literally go into the thousands. So at Cyteris, we really boil the ocean by starting off with a science-based database which is tailor-made for the client and the molecule. We then add additional dimensions like competitive environment, patient population sizes, unmet need, commercial potential, to really narrow the option down from thousands of indications to actually 100, which are relatively easy to process. We are very conservative to make sure that each step is biased towards having a higher rate of false positives, just to make sure that we don't leave any options on the table. So we are all naturally skeptical. So we pressure test every individual assumption which flows into a decision, and also transparently communicate this to the client. And this is in our mind very, very important, that the client actually, at the end of the process, knows for every individual decision point what has been the reason for excluding an indication and what has been the data behind it. It's important to find an indication with a high probability of success for a proof of concept. We typically work really at the edge of science, also in early development. So that means by the nature of it, there's a lack of scientific understanding about the biological link of the target and the indication. So typically you have to find other data sets with the surrogates you need for triangulation to actually making the perfect decision for the question at hand, for which you don't have the primary data. So that often actually means looking for new databases which are out there, and given the speed of scientific development, these actually pop up by the day. In an indication strategy, in our mind, success is not the indication which pleases the general market by having a very large commercial potential, but it is actually finding the truth, finding the real indication with the highest probability of success rate for the drug, where it can have the highest impact on the highest number of patients with the largest unmet need. Helping clients to avoid chasing the wrong signals is a very important step in the process. And this really entails very honest discussions with the client in a collaborative fashion to make sure that we all weed out indications we might have initially thought are actually best suited for the drug. And after having run the full process and getting the full picture, we need to prioritize more optimal indications, make sure to protect against late-stage failures, and be open to hidden opportunities which might have not been on the radar before. For me, the biggest satisfaction is actually that at the end of the project, the client takes action based on our collaborative effort and the indications we prioritize with the best fit to the asset. Because these typically then de-risk the asset, they lead to real impact for patients, which is a tremendous feeling, and at the same time, the company can further develop their portfolios. I think that's what indication search is about, really finding the most suitable indication for the asset in a scientifically grounded fashion and paving the way for a really true impact.